everyone, welcome to my YouTube channel. So how is red eyes managed in the clinic when you come to the eye care center? This is a follow-up video on the red eyes. We have discussed a lot about red eyes, and right about now we will discuss the management when you come to see me in the eye clinic or when you see another eye specialist in an eye care center. If you are new to my channel, feel welcomed and feel at home. Sit back and enjoy. And if you're always here, yay! I celebrate you. My name is Kemunto, an ophthalmic clinical officer, stroke cataract surgeon, with an experience concerning eye care management and ready to share it with you. So my dear viewer, have a seat, take a notebook, take a pen, and let's learn. Red eyes is the cardinal sign of ocular inflammation. It's one of the most common symptoms we encounter in the eye care center. When you visit an eye specialist with a red eye, history taking is a must. This is to help in the making of diagnosis. The history taking normally includes: when was the eye redness started? Is it on and off? Is it on one eye or both eyes? And also other symptoms associated with the redness, e.g. discharge, visual changes, severity of the pain if it is there, and also if you are sensitive to light, to mention a few. Also, we'll ask you the previous treatments that you've used. Why? Because it's always advisable to know the drops that you've used so that you know where to start from. We can also ask if you have allergies. Also, systemic diseases is very important to know. And finally, if you have contact lenses, we have to know whether you wear contact lenses. Visual acuity assessment is also a must to assess how much you can see. And for proper examination, we use a slit lamp to check the anterior part of the eye if there is any abnormality. And treatment will always be based on the underlying cause. For viral conjunctivitis, which is caused by adenovirus, is very contagious, whereas conjunctivitis, which is caused by other viruses, e.g. herpes simplex virus, is less likely to spread. Viral conjunctivitis usually spreads through direct contact with contaminated fingers or personal items. It's often associated with upper respiratory tract infection, which spreads through coughing. And this is the most common conjunctivitis we see in the eye care center, especially for school-going children, which is very common. Treatment is usually supportive and may include cold compression, artificial tears, or soothe the eyes from the irritations. Antibiotics are rarely given because secondary bacterial infection is uncommon. Also, health workers are advised not to go to work until the eye discharge is cleared because it is highly contagious. Eye specialists as well as are advised to clean equipment and instruments after every use with patients to prevent the spread of this infection. For allergic conjunctivitis, we give antihistamine, muscle stabilizers, and even artificial tears to soothe the eyes from the irritants. For infective conjunctivitis and blepharitis, we manage according to the cause. That's when we give antibiotics when there is bacterial infection. For inflammation like scleritis, iritis, uveitis, I didn't want to go to the medical term. We give topical steroids and even oral steroids depending on the severity. For corneal ulcers, we have to stain to find out whether it's active. So after we stain, we'll be able to know whether to give steroids or not. And also, treatment involves with the causative agent and the presentation, whereby we give antibiotics if it is bacterial cause. If it's because of viral infection, we give antiviral, and if it's because of fungal infection, we give antifungal drops. For anguloclosure glaucoma, this is a medical emergency. So we give anti-glaucoma medication to lower the increased eye pressure. We also do laser, which we usually call SLT, selective laser trabeculoplasty, which is a form of laser surgery we use to lower the eye pressure in your eyes. Also, we can give eye drops to lower the eye pressure. But the eye drops, when they have side effects, we prefer to do SLT. We also do glaucoma surgery, that is trabeculoplasty, to reduce the increased pressure. Medical terms? Let's continue. Red eyes can be harmless and can resolve on their own or even with over-the-counter medication. But it's always important to make an appointment with an eye specialist to rule out if it's a serious condition that is causing the red eyes. And the serious complications can be such as uveitis, eye injuries, corneal ulcer, subconjunctival hemorrhage, anguloclosure glaucoma, and even epicleritis. This is a just summary of the diseases that usually causes the red eyes. It is always advisable to relieve the symptoms, yes, or with over-the-counter medication, but it is very important to make an appointment to be seen by an eye specialist for evaluation, diagnosis, and proper management to avoid vision loss. Never be afraid to come for examination. There is usually no injection. Welcome to M&E Care Center. Come to Ongata Rongai along Magadi Road, Time 6 building, first floor, room 112. The clinicians are ready to attend to your needs concerning eye care. Come one, come all. Thank you for being here. I appreciate you so much. If you have any comments or suggestions, kindly comment on the comment section below. If you have not yet subscribed, kindly support my channel by subscribing and also hit on that notification bell so that every time I upload a new video, you'll be notified. Like and share this video. You may never know who you are going to help by just sharing. Until we meet next week, bye!